One.
I'd like to welcome everybody to the March 1st, 2022 Board of Health meeting. We have a nice agenda, a few out of the ordinary things tonight, so hopefully it'll be some good information for everybody. Just a little disclaimer, this agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other items not listed may also be brought up for discussion to the extent permitted by law. So we'll call the meeting to order at 6:02 p.m. Second on the agenda would be citizens' participation. I know I saw Mark. Usually you have something to add.
Yes, I do. Good evening, Dr. Sony, 49 Hawthorne Road, Ashland, Mass. How's everybody doing so far tonight?
Good. How are you?
All right. I'm going to ask a concerned question about the town and how it's run for elderly services. If I can ask anybody on the board can answer. The idea for me is to ask for the elderly services, elderly older folks that have doctor's appointments, physical ailments and stuff like that, and if there's no place here in Ashland to go, how can the community center reach out to get medical doctors into this town to help out?
That's a good one.
Yeah, I don't really have a good answer to that, Mark. Most, the only thing I can think of are basically, ride, basically things in place, but in bigger communities where people, can call and get transportation to doctor's appointments. But that's, I don't know that we have the resources to do anything like that. I don't, most doctors aren't going to, just take time out of hours, and unfortunately can't do house calls. They're not, just financially, feasible anymore. Are there specific services other than primary care medicine that you're looking for?
What I'm looking for, because it's been on the agenda on the planning board, and a place on Pond Street that's being built by Shaw's that has a retail area, and we want to put in a optometrist office in there. That's one good thing, but the people in the town really don't want to see something like that in there. They want to see different things for the younger citizens, but not for the elder services. So I'm just doing this because I want to understand that the elder services need more help than the under 50ers that can get around themselves. And when they have go ahead.
Yeah, that could be something that everybody could use if an eye doctor is going to move in, because a lot of people need help with vision and glasses. But most of the times, they're as far as that goes, I would probably talk to the office staff at your dad's primary care medicine, because there are visiting nurse associations.
Ron, I'm saying this.
Yeah.
Overall town citizens, the ones that have to use the MWTRA buses.
Yep.
Those have to go out of town. Why can't this town be interested in bringing in those medical services for them for in town here in Ashland, and look for open space in office buildings, telecron, and maybe some about market baskets to see if there's any small little office openings that they can help out to bring in the services for the elderly, so they won't have to take the bus to go out of town and spend that much time away when it's in closer for their physical needs.
Well, yeah, it's not really the town's, the town isn't, unless the town's going to actually hire and pay the physicians, then somebody who's in private practice is going to decide where they want to have their practice. So but, that's not unlike, any other smaller town, you have to have a population to draw from. There's got to be a need. So I don't think it's as simple as just, trying to, say we have, we have office space here. Let's get a doctor to come in there to fill that need. You got to have somebody that wants to do that.
Okay, well, why can't through both Board of Health and the community center, who runs the senior population in the senior center, look up on their files and see the citizens in those two areas and what they have for problems? Or why can't they have a percentage and then send that out?
I'm not following what you're saying. Most people are plugged into the healthcare system. Your father has a primary care physician, correct?
Yeah, but I'm not just talking in my house. I'm being citizen wide, but for the people over 65, 70 that has no mobility, had a mobility challenge, and has to go out of town, but they don't have their family members to get them there. Why can't something like that be in Ashland in different areas?
Yeah, that I can't tell you, but I know what most things have to do with money, and I don't think we're going to get a transportation system, to take those people out. They have to make other arrangements, whether it's taking a cab, getting other public transportation. If you got to get to the doctor, you got to get to the doctor. There's
yes,
yeah. I don't think it's feasible for the town to be able to have to do that. There's got to be a need for it. That's got to be a big planning issue.
And if people don't want to plan because it's not their parents or relatives that these stay in town, it's got to be somebody else's money, and let's say no from there.
Yeah, I don't know that that's a fair comment to make, Mark. I don't think that just because it's not their parents doesn't mean that they're not concerned about that, but I don't know that you can take care of every citizen's needs through the town. That's just my opinion. I think you have to, it's not like just because somebody can't travel, then if they're unable to take care of themselves, then relatives or those people need to find some type of skilled nursing facility, that these people, can be cared for. It's not like if somebody has a dementia problem, that you're going to have them living on their own and then need to go to a doctor's appointment where they can get there on their own. It's a pretty complicated question. It's not nearly as easy as you're making it out to be.
I'm trying not to make it as complicated or as easy, but I'm just seeing what
putting your head there, you're gonna hurt yourself.
What would be the concern? Let's just say if a person lives, I'm gonna keep the same town, lives here in Ashland, and I know that if an emergency happens, there's an ambulance, takes them to the nearest hospital, and there's no next relatives in the state. What would happen then?
They would still get cared for at the hospital.
Yeah, but they have to notify somebody. And
they can. They still would hopefully have next of kin. But if they can't, they're going to treat that person the way they need to be treated. So that has no bearing on whether or not you're in town or not.
No, but right? I'm just saying that if they're not mobile enough to be transported, and there's an in-town community, medical outreach, like one of those life alert buttons. Why can't there be like a couple offices like that here in town to assist?
You have to have the professionals. I mean, you could be talking about cardiology, you could be talking about orthopedics, you could be talking about pulmonary, you could be talking about GI. That's a lot of different practitioners, that I don't think that that's a feasible way to deal with a percentage of the population. I would think that everybody in the area is pretty well plugged into the, to the system, and you got to figure out, how to get there. I don't think it's up to the town to provide, that service as far as the Board of Health goes. We can't, deal with every single health issue that somebody has, personally.
Well,
That's my opinion.
That I appreciate the opinion. It's understandable, and I know you got a big agenda. But since the idea of the Pond Street project came up, and nobody wants to see a retail or professional building in the building that's right Shaw's, that they want to keep something that's there good for the residents and economically well warranted. But then again, a person's elderly health family is warranted too.
Right.
Thank you.
I agree, Mark.
That's
right.
it. Thank you.
But okay. All right.
No, you can answer.
You're welcome.
I'm just going to mute myself.
No, there's nothing to answer. You have to, to do something like that. I don't think people would be opposed to, a medical office building, but you have to have the professionals to staff that building. So there has to, a hospital like, a Partners Healthcare or, some other healthcare system like Caritas or, Data Medical Associates, that healthcare association, unless there's some type of feasibility study that says there's a need for that in a community and surrounding areas, that's a pretty big undertaking to, basically build the facility or find space and then staff it. They certainly wouldn't be doing it just for the town of Ashland. That's for sure.
I do understand, but it is a need, and it's an understandable of how it can be recognized by a certain, like the West surveys and stuff like that, and what's the percentage of the Medical West think about and stuff like that. But it is,
right.
But it is a certain understanding to have a thought on.
Yeah, you can think about it, but I don't even know how you gather that information unless people are calling up the Board of Health saying, I can't get, I need these services and I can't get them. I'm sure that's if somebody.
Ron, can I make a recommendation that maybe
that.
Mark bring up his concerns to the Council on Aging or the Senior Center Director, because there's a lot of services that I think unless we ask, we don't know is available. And it might be something that, these are good ideas and they might be able to help Mark with some of the concerns.
I understand that. The chance to you, Diane, I understand, and that's what I want the board. I want the age. What's that again? What's the name of that again? Group?
The Council on Aging.
Council on Aging.
Yeah. I want those two, the Board of Health Aging, to do that because they got all the names and files and everything. Well,
we don't. I know we do need to move on because this is not something that we are in charge of here, is offering services like that. So.
Well, the Council on Aging would.
Well, because they do have a vehicle that they offer transportation and things like that. And they do offer services for people. So I think you should address your concerns with them, Mark.
Well, to work it out between the Board of Health and Council of Aging, it's working about people's health and what to do, and working inside the borders here instead of going outside and pay extra off of their monies, where it can be closer and more immediate in case it's an emergency.
There are ambulances and other things in places for emergencies, Mark. I don't think you can look at every medical issue, as a contingent thing, but that's a great idea. So,
okay,
Mark.
I'll leave it at that. Thank you.
Yeah, thank you. Okay. So, Superman, you there? Sergeant Berman?
Yeah. Hi, everybody.
You have a COVID update for us?
So good news. As everyone, I did send out the stats last week. You can see our numbers are definitely trending down. On a positive note, we only got 4 additional cases in over the weekend. So really good news. Where we are seeing still some issues at some of the younger daycares, like those 1 and 2 year olds. A lot of those daycares have been calling me. We don't get the numbers in, but the parents are calling because they did a home test, and I'm just guiding them what to do. And that's been actually fine. It's not been an issue at all. And then initially we were going to talk about the schools, but Jim is here, so I'm going to kind of let you know where the schools are taking things next.
Is that my cue?
Okay.
I don't know.
Yeah, sure. Why not?
Sure. Thanks for having me.
Read the rest of the meeting. Hi, Jim.
Thanks.
How are you?
Thanks for having me.
Yeah.
And you know, it's certainly an interesting time in the schools for sure. As you know, the Department of Ed came out with a statement probably 3 weeks ago that their mask mandate, if you will, is over as of yesterday, the 28th. And then the CDC put out their recommendation, their guidelines for busing and wearing masks on buses in public schools and public transportation, which they were recommending there's no need to continue to wear masks. Well, as with everything in Massachusetts, it's a local decision. And the school committee has policy that we wrote and have been rewriting continuously throughout the entire pandemic for 2 years. And the face covering policy we adjusted 2 weeks ago, which was to allow for optional facial covering starting Monday, March 7th. And the reason we did that was in conversations, so that's next Monday. The reason we did that was in consultation with our nursing staff. They felt they wanted a week to see where, if there was a surge of numbers coming off from vacation week, which to them was important because that's exactly what we've seen throughout the entire pandemic is coming back. The week we come back, we've seen surges. That being said, the state has provided all school districts with the opportunity for the antigen at-home rapid tests. And we have probably 25% of our students who are currently utilizing that system and about 60 to 70% of the staff who are using that. So we test every Tuesday. So this morning, students who are participating are supposed to test it Tuesday. And then if they, are positive, they call the nurse's office and let them know. And we actually do record that in the Maven system. And we report that if it's in school. So if we identify a case in school, we report it. If it's at home and they call, we report it to the Department of Ed, but we don't report it in the Maven system. And so that being said, school committee voted to change the policy to allow for optional masking, if you will, starting Monday. And Thursday evening, they will again modify the policy because of CDC's late Friday night guidance of removing facial coverings for transportation. And the reason why we have to revisit the policy is because, again, at that point when we made the decision to go optional facial coverings, the guidance was nurses' offices as well as transportation still needed to wear facial coverings. So just one more loophole that we have to get through on Thursday, and come Monday, as a little third grader said to me this morning as I was walking through Mendez, "Hey, Mr. Adams, is it true?" And I was like, "What's true? What are we talking about, my friend?" He's like, "Can we take these things off on Monday?" I said, "Well, that's a parent decision, and you'll have that conversation at home. But the option to do that is yes, and that'll happen on Monday." Most districts around us, I don't say most, probably 60-40, started yesterday with the process of optional face coverings. There are some who are starting Monday as well, and some actually haven't voted yet, believe it or not, in the Metro West area. So coming back from break, I think we've had 5 total cases reported to us from the at-home tests. which is not many at all. And those actually, those cases occurred actually during the week of vacation, not actually on that Sunday when they tested or this morning. So interestingly enough. So that's where school committee is headed. I think we are in a good position from a air quality standpoint within the buildings. We have probably, it'll be interesting to see how many folks actually do remove their facial coverings. I think it'll be a slow, steady transition for folks. I don't think it'll just be everyone's going to rip off the Band-Aid, if you will, and go without mask on Monday. What we've seen in other districts is about a 50%. Then after about a week, it's about a 60%, and then 2 weeks, 70%. And so it steadily will increase as time goes on, which is what we're expecting in Ashland as well. So that's really where we are. We've had tremendous success with the surveillance testing. Like I said, the antigen testing at home. The one concern we've had with this entire process is that the stigma of folks who still might want to wear a facial covering. And that's a conversation that we're having in all the classrooms, especially at the younger level, where we have an opportunity to do a lot of social emotional learning conversations and through the middle school, that, hey, some folks are going to wear and continue to wear because they might have someone at home who's immunocompromised, or they might have, might be immunocompromised themselves, or haven't received all the vaccines yet. We're at a very high percentage of vaccination rate in our schools. The middle and high school are well above 80% of our students. We have 97% of our staff. And Mendez and Warren are steadily getting into the 60s and 70% range. So it's good, positive news. And I think the last I checked, Ed, I don't have the accurate number, but I would say close to 30% of our students have actually contracted COVID over the course of this last year. So, and the Omicron certainly went through many of the buildings. But with, again, I try not to minimize the impact, but certainly not, we didn't see much in terms of severe sickness. So I'll stop there and give you opportunity.
Great. Any board members have any questions?
Yes, I have a question.
Sure.
So yes, that masks are going to be optional.
Yeah.
But are you going to maintain like the 6 feet, 3 feet distancing within the school system, all in the buses?
Yeah, great question. For the remainder of the year for transportation, the answer is it's going to be status quo, right? And we'll still continue to have windows down. Students will still sit where they're separated. That being said, in the lunchrooms, we're going to continue with how we currently have the setup, at least for a month. We want to see how things go. We're not just going to make a quick transition. I know some of our elementary folks wanted to just make a real quick transition into it, and I said, pump the brakes a little bit. We're going to maintain our current cafeteria setup at least for a month. Let's get through getting folks used to not having the facial coverings. Let's continue to watch our numbers, and then we'll make further decisions as we progress. We don't have 6 feet of distance in the classrooms anyway, currently. So that's not an option. The only way we could have done that is, again, in a hybrid model where our numbers are unbelievable. Our growth, I've shared with the school committee, we have 140 extra students this year compared to last year. We're growing. The town of Ashland is growing significantly still. And so to keep them separated is would be a challenge from there. But from the lunch perspective, we are.
Do you get a feeling, Jim, from, the faculty that, a lot of the teachers will continue to mask up, or not that their choice as well, I'm assuming?
Yeah, it is. It's their choice. That being said, Ron, I think we're going to see that slow progression, right? I think we're going to see a 50% the first day, and continually move towards the majority of the staff. But I certainly can anticipate 20% or so of the staff continuing to wear face covering for the remainder of the year until they see it. Again, it's about feeling comfortable with the numbers and seeing how things are progressing. But that's we're leaving that as a personal decision.
Yeah, of course. Is there, as far as monitoring, is there a threshold percentage of students or number, at which case masks would be mandatory again? Is that already set up, or is that?
Yeah, no, we have not. Yeah. The way the policy is written, that if we see, in this, again, this will be in consultation with medical professionals and looking at local numbers, but the way the policy is written is that I have, the school committee has given the authority to the superintendent, should we see, even in a specific building, a climb in case rates, that without doesn't have to be a specific metric, but if we feel uncomfortable, it can be an immediate requirement in that building to return to mask until we're comfortable again. So that's part of the policy.
Okay, understood. All right. Anybody else with any questions? Ed, you good? Raj, Di, Jay?
Nope.
I just want to say thank you, Mr. Adams. Thanks for your update.
No, you're welcome. Yeah, it's good to get me out of some of the other things I got going on tonight for the meetings.
All right. Hey, Jim, thank you very much.
Appreciate it. Thanks everyone for all you do.
Thank you. All right. Have a good night. We appreciate it. So, all right, moving ahead to agenda item 5, Kristen French, who is, does a wonderful job, for the town, heading up the Cities at Every Turn Coalition, and director of prevention outreach. I was hoping maybe you'd be able to give a little bit of a Reader's Digest version to the newer members about, kind of how you came about and, what you really do. But, Kristen and her, and the coalition are designed to hopefully mitigate, drug use and smoking with our youth. And I think they do an awesome job. And they were the first recipients as a group of the Mary Mortensen, or is it the second? The second maybe, of the Mary Mortensen Ashland Public Health Award. So thanks, Kristen.
Well, thank you both so much. I was really happy to receive Raj's invitation to present at the Board of Health meeting tonight. And I wasn't really quite sure where to go, but I think just by way of introduction that Ron had mentioned, my name is Kristen French. I've been with Decisions at Every Turn actually since 2014, but not in the director role. Probably like 2017. But for those who are unfamiliar with who we are and what we do, we are a drug-free communities coalition. We work with community partners to reduce and prevent youth substance use here in Ashland. So pretty much everyone on this call, I've worked with, I've partnered with, we've collaborated with, we've done programs with. So it's super nice to see everyone here today. So really over the last couple of years, I mean, those who have sort of like moved with us through the years, things might look a little bit different than how you might have come to know us. But probably since 2018, we've changed things up just a little bit. We've adopted a framework of positive youth development as a foundation for our prevention. And really, we've really focused on this concept, this framework of developmental relationships, and have really prioritized positive adult youth relationships as a protective factor. for substance use. So you'll actually see a lot of our language, a lot of our programming really elevates the importance of not just parent-youth relationships, but teachers and youth and coaches and youth and community members and youth. So that's woven throughout all of the strategies that we do. And the other thing that we have sort of expanded our focus, and those of you who work in the field know very well, mental health and substance use often happen together, not all the time. So when we actually have looked at our strategies over the last couple of years, we've embraced a lot more mental health work. So you'll see this also woven through a lot of the strategies that we've done over the last couple of years. But really, just to kind of give you a snapshot, probably like pandemic until now and what we've got going on over the next couple of months, we've really focused on, I would say, 5 core areas. Data collection, capacity building, which is really training people and to understand prevention, social media, I have to write them down actually, programming, and what was the other one that we do? And outreach. So I just wanted to kind of go through all of those like super quick, just to kind of give you a sense for those who aren't familiar, what we've been doing and what we will be doing coming up. So all of the work that we do is grounded in data. And we're actually lucky that the pandemic has pushed some of the scheduling around. So we're almost collecting a lot of data almost within the same time frame. So within the last year or so, we've been able to conduct focus groups. The schools have conducted their Ashland Adolescent Health Surveys at the middle and high school, which serves as our core data set for the work that we do. We don't own the data. That's actually owned by the schools, and the superintendent is very generous in letting us use the data to be able to inform our work. We've also just administered a parent survey to collect parent feedback on use and perceptions of use in Ashland. Will be in the spring, we'll be doing a positive community norm survey at the middle and high school, which will look at perceptions of youth use. And then this past spring, we actually did another survey on developmental relationships and assessing how young people perceive the adult relationships in their lives. So most of the data is in. Some of the data won't be in until the spring, but when we have that, we'll have this like robust set of what young people and the caring adults in their lives think about prevention in Ashland, and that'll help us, do the planning kind of going forward. So that's been a really big focus, and we're really excited to have that much like rich information available to us. And actually, before the call started, Rob was actually asking what it was like, to work over the last couple of years virtually, because so much of the work that we do is in person. But it's actually helped us collaborate and outreach and build partnerships probably more than we've had in the past, because I think people were so stretched in what they were doing that there was a need to come together to actually do a lot of the work. So the connections with businesses, by help with Beth and Ashley and helping us connect more businesses has been great. We've been with Raj coming aboard and trying to do things with the Board of Health. We do a lot of work with the schools, obviously, with the Human Services Department. We've been doing some work with Area, which has been great. A little bit of work with the library. So I think we're all coming together, and it's been really, really nice. If any of you had seen the Choose Kindness stickers for Kindness Week, that was a lot of fun for us to work with community partners to really promote kindness, which really is prevention. It's really letting young people know that there are kind people in their lives, and when you kind of build that foundation, then hopefully they'll feel supported and nurtured, and will develop coping skills. So if they do have challenges, they're not necessarily going to turn to substances, but might turn to someone in their life that's really important. For programming, for anyone who is interested, we actually launched Hidden in Plain Sight on our website. That's that in-person exhibit where parents can go through the mock teen bedroom and identify potential signs of youth use. We've adapted it virtually. So now people don't have to go out. They can just go on our website and go through the whole thing online, which has been really great. We have a couple programs coming up in March focused on, so March is National Women's History Month. So we wanted to do some programming focused specific on girls and teens. So we have a couple programs in March coming down the pike on that line. we were able to do, not in some in person, some virtually, a lot of mental health related training over the last year. We trained the police department and a lot of town staff on mental health first aid. And we did several parent and community workshops on mental health literacy, which just sort of provides the skills to be able to maybe identify some warning signs when a person in their life is struggling, and to be able to know what resources are available, things along those lines. We've partnered with the schools to bring in some mental health programming in grades 8 through 12, which has been really great through the health and wellness classes, which has been really well received. And we brought in a developmental relations workshop for school staff and some town folks as well. So that's sort of helping to build that foundation and help people become a little bit more familiar with the work that we're doing. And social media, I'll put in a little plug. If you don't follow us on Facebook, please do. We're also on Twitter and Instagram. In the last year, Talia CV, who is our coordinator, she oversees our social media. She's put together 6 wonderful, like, substance use related social media campaigns, and there's so much information that she puts out there, and a couple social media campaigns on the positive youth development piece. So that's all been like really great. And then a couple of the things that are coming over the next couple of months with National Drug and Alcohol Facts Week and Drug Take Back Day in April. There'll be a lot of stuff that we'll be pushing out as well to coincide with those big efforts. But I did want to, certainly we'll have time for questions if you have any questions, but a couple of things I also did want to mention before I ended. April 12th is our next coalition meeting. It'll probably be virtual, but at that particular meeting, one of the things that we'll do is review the data from the parent surveys. So if that's of interest to you, that would be great for you to join, because we'll be going through the results from those. And I'm also excited that May is Mental Health Awareness Month, and we're going to be working again with community partners and reaching out to really encourage, whether you're an individual, a town department, a business, or a service provider, to somehow support mental health in Ashland. And we sort of want to serve as the conduit for whatever people are doing, and be able to share out to the community in like a calendar form, on these dates, you can attend a yoga class, you can attend a workshop, you can turn, this session, or, this department is offering these resources. So it's a way to kind of fold in everything that we're doing, the mental health, the collaboration, using the data, do some training and things like that. So I'll probably be reaching out to pretty much everyone on this call here to see if there's a way that you'd be interested in doing some mental health support work in May. I think that's it.
Oh. You sound too busy to be doing anything else. That's a heck of a broad spectrum of things that you're doing. So it's really great service to the town. And, I know I'm sure there's a lot of parents that appreciate, your efforts. Any board members with any questions? Okay, I'll start. Just from either your surveys or, from what you've seen trending, just, with major things, such as, vaping or combustible cigarettes, or, cannabis, are you getting a feeling that, either usage is steady or declining, going up? What do you think with most of it? Alcohol use, or are there less kids trying it? Just wondering.
Yeah, so it's actually interesting, because the data set that we would normally use to do trend data we delayed that a year. So in order to be able to say, when everything is done at the same time, in the fall, same questions, that's when I could really be able to say, okay, I can say that with confidence that this is where things are really going. That being said, we do, just sort of talking with parents and with the students themselves, and through the surveys that we can't do trend data, but we can know what's going on. I mean, in terms of the substance of choice has been vaping, and that's, kids will say it, parents will say it, so, has it gone up? Has it gone down? Where it is, I can't definitively say, but I will say that of all the substances, that's sort of where what students are using. I would also say vaping nicotine as opposed to vaping THC. I would also say that both the parents and youth are on the same page with mental health being a root cause for a lot of just substance use in general at this point. I'm trying to think of some of the other pieces. I think there was actually a Monitoring the Future survey, which is a national survey. I think I might probably have to go back and check that just substance use in general had declined just because of the way, like we would think with, I'm not talking Ashland, I'm sort of like talking all across the board, because like access has been so different with the pandemic, because like parents aren't going out, you're not having parties, so kids can't like get into the liquor cabinets and things like that, and it's just a little bit more challenging to be able to like access substances. So I'll double check that, but I think that is was one of the results that they put out there. But but it's sort of like a one-off, because the last 2 years has been so different. So like, what are we going to see when we're like emerging out is sort of remains to be seen.
Right. Yeah. That's great. Anybody else?
Yeah, I just have a simple question.
Yeah.
Thank you so much for your presentation. And my question is in regard to, you said from your observation or from the data that you have, you see, I think vaping is more common among the groups. Is there a reason you think that category of people prefer vaping other than any other categories? Do you have a reason?
I think that, I think it's probably easier to access than some of the other ones, but I also think the perception of vaping is that it's not as dangerous as other substances. So that, without having like everything in front of me, generally speaking, when the perception of harm is lower, then students are more likely to want to engage in that. So their perception of vaping is lower than trying alcohol or trying marijuana. So that's generally an indicator why vaping rates might be higher, is because they just don't feel that it's as risky of a substance.
Okay, thank you.
Mm-hmm.
All right. And anybody else? No? Okay, Kristen, thank you so much for the work that you and the coalition can do. It's, a great thing for the town, and, you certainly, do a lot of things that Rod certainly would not have time to do. And it's what a wonderful thing, even if you can keep, a few kids, off of anything or prevent them from smoking, it's a win that, that's for sure. And, money and time well spent. So, and so we appreciate everything, and thanks for coming on and volunteering your time to give us an update. It's great. And if there's anything that we can do for you, like you said, if there's anything I can do with the mental health awareness thing, I can certainly try for you. So I'll reach out to you, see if there's anything I can do or help you with. Okay.
That'd be great. And really the coalition is the community. So it's really, how can I serve the community? What needs does the community have that the coalition, can work on together. So thank you.
Right. Yeah, that's great. Thanks, Kristen. I appreciate it.
All right.
Yeah.
Thank you.
All right.
Okay. Good night.
Okay. Right. Item agenda number 6, the town election in May. I don't even know who's up and who isn't. I know I have another year, or how many vacant seats. Diane, any? You may have had a few things.
Yeah, I had asked Laura to put it on the agenda because I did want to notify the board as well as the residents of town that I am not going to seek re-election in May. I've been involved with the Board of Health Department in many different ways for 31 years, and I have some things in my personal life that are taking up a little bit more of my time these days. So, like I said, I'm not going to seek re-election in May. So I know obviously Jay has pulled papers for the 3-year seat, which is good because that's the term that I would be running again for. So there's the 2-year vacant seat from Jay's. If he gets, obviously he gets elected to 3-year. But so there's still the 2-year seat left for people to pull papers. I believe the deadline, and I'm not working for the town clerk's office, I believe the deadline to return papers is the 28th, but people can contact the town clerk's office. So again, I just wanted to notify the board publicly and the residents. So thank you.
Ron, may I?
Sure. Well, first, Diane wanted to, thank you for all your service, and you'll definitely be missed on the board as a valuable member. And you bring a lot of knowledge and information to the board, from where you sit, and you'll definitely be missed. So thank you for all of your time and efforts with the animal control and all the other things you've done over the years.
No problem. And I know everybody knows where to find me, and I'm still around, so I'll try to still volunteer as much as I possibly can.
Right.
Thank you, Ron.
Thank you.
Ron, I guess you stole my words.
KG. Yeah.
Ron, you stole my. Thank you, Diane, for the tremendous amount of service that you've done for the town as well as the Board of Health in general.
Yeah.
And I really appreciate your help whenever we need help. I'm sure you've always stood up and then come up with ideas and suggestions to improve the Board of Health. Hopefully you'll do that. Incidentally, I just want to let all of you know that I've moved into Ashland as of today,
Right.
back in town.
Did you get your papers yet then?
Not yet. I just heard from Diane today, so
Okay.
I will
Okay.
shortly.
All right.
Thank you,
That's
KJ,
great.
and welcome back.
Yeah, thanks, KJ.
Yeah.
Welcome
Thank you.
back. Welcome back.
You are the first board officially notified that I'm back in town.
Okay. Conservation Committee might be jealous of us.
Yeah, well, they could. There's no vacancy there.
Oh, no. Okay. All right. Well, good. Then, hopefully we have you.
Yeah.
All right.
Thank
Moving on to the consent agenda. The review and approval of minutes from February 1st and February 15th, and the year-to-date budget reports. Has everybody had a chance to get a hold of the minutes on February 1st? I believe was that the date, Guy? I mean, Laura, that you sent out, or was it the 15th?
So the February 1st ones went out a couple of weeks ago.
A couple of weeks, right? So it was the 15th that you just put on there?
Yes. So if you want to hold off on those, that's fine. I just wanted to get them to you.
I read the February 15th minutes.
Yeah, I read them as well. Did everybody previously read the February 1st minutes that was on there?
Yes. It was
yes.
It was Jay, yourself, and Ron, Jay, and myself at the meeting.
Right. So do we want to move on these individually then? To approve the minutes instead of just because there were different amounts of people there, or we just move it as consent agenda A?
Well, if everybody's all set with the minutes, we can still approve it, even though the other board members weren't physically there.
Okay. All right. Anybody like to make a motion to approve the consent agenda?
I'll make a motion to approve the consent agenda.
Okay. Anybody like to second that?
I second it.
Okay. Great. All in favor?
Diane, aye.
Aye. Right.
Aye, Barbara.
Aye, Barbara.
Aye, Jay.
Good. Yep. Right. Bernadette, you in as well?
I thought I said, oh yeah,
Yeah.
I.
Okay. All right. That passes 5-0. Thanks, everybody. John, any update on agenda item 8, the remote area medical?
Yep. Hi, everyone. A very small update. I did get a call back from RAM and an email, and we've set up a phone call for this Friday. So small update, but that's a good sign. It means that they are interested, at least in talking to us about the venue and the feasibility of doing it over at Keefe Tech. And so I guess in 2 weeks, I will have a better update for everybody.
Okay. Well, that's great. And thanks for continuing on that path and helping us out, with that. Raj, you're up. Health director's agenda. So excuse me.
Thank you, Dr. Ron. Good evening, board members, residents. Just want to update the board first on the grants. Just want to brief what's going on with the grants. So right now we have 3 grants that is with the Metro West Share Services and 2 of our own grants that's just with the Ashland Health Department or Board of Health. Our grants are more related to food and foodborne illness investigations. The other grants with the share services for general use, more with COVID or other diseases in the community. I just want to update the board on the staffing also with the shared services what we have right now. So we have 1 full coordinator or the director, what we call it as, 2 epidemiologists, 1 full-time public health nurse, 1 part-time public health nurse is joining us very soon, or they probably have joined this week. Then we have a communication specialist, 1 community health worker, and I guess we have some more money to hire probably another part-time nurse at this point. So that's the staffing we have, and they are helping us a lot, with whatever we are doing. I mean, some help with COVID, or other help is more with the childhood vaccines or the BP clinics we're putting. So with the childhood vaccine, that's my second item. We did had the DPH walk through our space, on the 18th February. Thank you, Diane, for being there, and Sergeant Berman for arranging that. We did get clearance from DPH yesterday, and we should be able to order vaccine now. We checked it this morning, probably it's just like maybe some authorization or something, but we was not able to order it today, but we should be hopefully ordering it soon, and then we'll be starting the clinics. I mean, I'm very happy. Thank you for everybody's assistance on this. About the blood pressure clinic, we are gonna be restarting the blood pressure clinic at the community center, and tomorrow, 10:30, we're gonna be our first clinic. Just from the shared services, she's gonna be the coordinator for this. I guess the other part-time nurse or she might be bringing an intern with her, and I'll hopefully be joining them too at the clinic. So that's one news. And lastly, I want to update the board on some of the housing cases we had picked up. We had a few housing cases, especially with no hot water. There are a couple of them. It's very, like with the season, we see these kind of cases, but 2 of the no hot water cases are resolved as of now. And we're dealing with some more with the other housing code violations. I guess that's all I have. If anybody have any questions for me, I'm here.
So Raj, the vaccine, is great, but how are those services being promoted to the parents of the kids in town that may need that? How does that work?
Dr. Ron, given the complexity of there are so many variables in this, right? So early on, initially, what we're going to do is, whomever reach out to us, like as even in fact, yesterday, somebody came to our office, that looking for a school going, childhood vaccine. And I have coordinated with Hopkinton today, they have some vaccines, that they can arrange to get that done. But initially, we're going to take a slow approach, given if anybody reaches out to us, that we're going to be giving it to them, because it's like 8 communities in this, and we don't want to, for right now at least, we just don't want to overburden the system, we just want to go slowly first, anybody who reaches out to us, and then after that, once we have full things in place, we'll go like, social media and reach out to school departments, and all that, So
okay,
that's the plan for right now,
Okay.
Okay. Raj, so talking about the vaccines, are you looking more towards just starting like with young generation coming into the school system, or is it going to be throughout all the
So
age
it's
groups of school?
sure. It's more for, the folks who are trying to get into the schools. There are a lot of need for, kids coming to school have no insurance, the immigrants, and all that stuff. It's basically, we're going to be initially doing it for those folks who have difficulty going into the school system because of their vaccination status. That'll be the first take, and then we'll see where the program goes. We might extend it to like TB testing, other vaccines. We have to see. It's a huge undertaking, and with the shared services too. The staffing, or the funding. But initially, that's the plan. To just vaccinate school-going children. Especially with no insurance. And this vaccinations, this vaccine we are actually getting from the state, and there are some requirements like to whom we can give it to.
Yeah. Okay.
So
Well, thank you. You guys did a great job to get that. I know you guys,
thank you.
and Ed and the whole team. That's really needed for
I know,
people who
and
have no
Diane was
access.
like working for so many years on this, and it's finally coming along. And I want to thank Diane. I know I see her to day, and still she's going to see her on some of the few more meetings. But I appreciate all that she did for the town, and the community.
Thank you,
And
Raj.
Dr. Ron, I just want to say, I know Sergeant Berman is still here. We had an email from Sergeant Berman today. I don't know if we want to brief the board,
Thanks for that one, Raj. So I want to let everyone on the board know, I did give my notice today with the town. I have accepted a pretty significant position at a police department in another community. But I'm around, I always tell people I'm a phone call away. And I live in town, so I'm going to still help with everything. And Jay, I still plan to help you with the RAM clinics. And but it was an opportunity I could not pass up.
We'll miss you officially.
Wow.
Yeah, for sure. Well, congratulations to you, Ed, and thank you for all your service to the town through all the things you've done.
We don't know. We don't know who do we call. We don't know who we're going to call the drug czar anymore.
Well, ironically, he was obviously a recipient of the Mary Mortensen Award this past year. So it's nice to have two of our nominees and on our meeting tonight. But Ed, thanks a lot for all your work. It was a long couple of years, and you made it a little bit less painful for all of us. So good luck and congratulations on your new job.
Thank you.
Good luck.
Thank you.
And we know where you live.
I know.
We'll still call you.
Exactly.
Some of us don't know where you live, Ed.
Like I've told people, I'm a phone. Listen, I laugh. I left Framingham 9 years ago, and they still call me. So, so I'm sure Ashland will still call me for everything.
You're the most wanted person.
KG, I'm scared that you moved back in town.
So Ed, is this it for you, or are you,
no,
are you on the next meeting? Or
yeah, I'll try to jump onto the next meeting. My last official day is next Friday, a week from Friday.
Okay.
And I start the new position on March 14th.
Okay, that's great.
Yeah.
Congratulations.
Thank you. We can all have conversations, and we can all have conversations offline.
Okay.
Sure. Thank you.
I know Barbara has my number.
All right, Barbara, you're in charge of getting all that information. Okay, anybody, we'll have the usual things on the agenda. Anything else? I think Diane made the good point. So I guess we should probably at least, talk about the award next time, because isn't it coming up for that?
Yeah, usually I think it's the first week in March or first meeting in March. So I think we're a little past it, actually.
Yeah. So
But I think if I remember correctly, we usually do the nominations and then have another meeting and then usually do it in April, right?
Right. something like, yeah.
Yes, we'll put it
So,
on the
okay,
next
so
agenda. Yeah.
We'll put that on the next agenda and.
So the next agenda will
uh,
be the nominees, correct?
Mhm.
Right, everybody will come in with, people who they think they'd like to nominate. Perfect.
Now,
Anything
just
else?
to refresh my memory, do we do the nominees and vote on the person that night? We can do that, right, at the next meeting?
Yeah, usually we do that.
Okay.
I think that's the way we did it last year. We just talk about it and, okay.
Sounds good. Thank you.
Anything else? Anybody have any other additions to the agenda, at least for now? We can always add things. No? No? Okay. All right, on to item agenda 11. Anybody want to make that motion?
I'll make a motion to adjourn.
Yes. Any seconds?
I'll second it.
Okay, all in favor?
Diane, aye.
Aye. All right, welcome back, KG. Ed, thanks again.
Thank
We'll see
you.
everybody in a couple of
Bye.
weeks. Raj,
Bye,
thank
guys.
you.
Have a good night.
Yeah, thank you,
town.
Guy, as well.
Good night.
Yeah.
Good
Good night.
night.
Thank
everybody.
you.
Good night.
Thank you.
Bye-bye.
Good night.
Bye-bye.
Thank you.
Bye.